Hi, my name is Hypnotherapy, and in this video I want to highlight some of the conceptual and pragmatic and systemic differences between psychotherapy and hypnotherapy, differences that will help you choose the right therapeutic path for you. Now I'm just going to touch upon three major ones and then address the context of healing from chronic illness and cancer. So the first one that I want to point out is that traditionally psychotherapy systems have focused mostly on an intellectual understanding of a problem. In other words, psychotherapy primarily engages the conscious mind, the part of the mind that we hypnotherapists believe account for only 10% of the mind. Hypnotherapy primarily engages the subconscious mind, the part of the mind that accounts for the rest of the 90%. It's the part of the mind that harbors information. In other words, everything that ever happened to you from birth till this moment in time that was perceived through your five senses, touch, taste, sight, smell, and hearing, was recorded and is stored within your subconscious mind, ready for recall and review. This is a very important function that allows us to make lasting change, permanent change, to change the quality of habits or fears forever. Once the change is done, it's permanent. And where the conscious mind is really the part of the mind that is more assigned to reason and critiquing and evaluating aspects of information that comes in. That's basically a very major difference between psychotherapy and hypnotherapy, conscious versus subconscious. Another difference that stems from these two different job descriptions of the components or agencies of the mind is the fact that in hypnosis, you're reliving the experience. You enter a trance state where you can relive the experience. You become an active participant in the experience. In psychotherapy, you talk about the experience, hence the label talk therapy, and you intellectualize it, you rationalize it, you look at it from the outside, so to speak. Another major difference, and this is important because once you go through the experience, you relive the experience, you are able to make adjustment to your perception. This brings us to the third difference, which means once you make adjustments to perception of certain moments in times, you affect rapid change. Change happens almost immediately. Where in psychotherapy, the therapeutic paradigm talks about long-term therapy, sometimes even years. These are three major differences between psychotherapy and hypnotherapy. There are a few more, but this is not the appropriate time to talk about them. The last thing I want to touch about, specifically in the context of healing from cancer and chronic illness, is that the subconscious mind is the part of the mind that governs all bodily functions, including immune function. So in this respect, if we want to affect any change or revive the immune response, we have to work on the subconscious level to identify those elements that weigh heavy or suppress the immune system, the immune function. And by resolving them and cleansing them and healing them, we are able to revive the immune response. A very major difference that psychotherapy just is not designed to do. So hopefully you've got a good amount of information to understand the differences between psychotherapy and hypnotherapy, and you're in a better position to choose the right therapeutic path for you. Thank you so much for watching. My name is Hypnotherapy, and I'll see you in the next video.